good evening, good night. We are inside. It's the effects of COVID-19 on the family, the blueprint. And today's topic is stigmatization. So take this time to like, share, and invite your family and friends to join in on the discussion.
Cause another home's falling apart. Oh, what a shame. Another group of broken hearts. It's not a secret. We all know that it's slipping away. Don't let it go. No, don't you let it go. It is the only true foundation on which we can survive. Don't be afraid. Cause you gotta take a final stand. Don't be afraid. You gotta try to understand. Bring the family back. Bring it back together.
So let's say good evening to each and every one of you. And welcome to the effects of COVID-19 on the family. The blueprint.
Yes.
With Shamika James, our social worker here. And today's topic is stigmatization. Stigmatization. Stig.
Hi, Nicola. And
Hi,
we
Chini.
have Abby from the UK with us on the inside as well. And we may have Verena joining us in a little later. Yes, we want to welcome each and everyone to the effects of COVID-19 on the family. Yes, and we will get into it very, very shortly. We are going to start off with a video and then get into the discussion on stigmatization and how COVID-19 has brought about stigma, against families, against communities, and so forth. Yes.
When healthcare worker Patricia Byrne tested positive for COVID-19 back in March, her cough was so bad she wasn't sure she would make it.
And so I was devastated and I was scared. And I thought, I need to write a will.
But her relief at recovering was quickly replaced by a feeling of isolation, even after she tested negative and returned to work.
People that I ate dinner with for almost 10 years, I noticed weren't coming in the room. I actually broke down and cried. I felt like a leper. It's the only way to describe that.
Deshauna Ballard knows the feeling.
I felt like an alien, honestly.
She's had several negative tests since she was hospitalized 4 months ago, but she says the stigma is lingering long past her physical symptoms.
I think the most painful thing was people not understanding your experience.
One member of her church told her catching coronavirus was the result of a sin.
It got to the point where I don't want to tell people.
Dr. Michelle Prickett says instead of being ostracized, COVID patients should be praised for opening up about their illness. Being able to trace their contacts helps stop the spread.
So they're really the heroes here, saving lives, going against what are clear kind of social stigmas that we need to break through.
She treats COVID patients in the ICU, seeing the devastation it can do to a body, but also fearing what it can do to a mind.
It's the emotional health that I think we're going to be dealing with for years.
Side effects that could linger well beyond the pandemic. Kristen Dahlgren, NBC News.
Yes. So your stigma and discrimination is a real thing. All right. And when persons, look at somebody, at a person who is worthy, but they look at them like they have no worth. They treat them with no equality. They just turn away from them and they isolate themselves. They stay away from persons who would have had COVID-19. Hi, Candice. Right? Now, in this case, we see that persons who would have been persons who contracted the COVID-19 virus, after they recover, or if it is persons heard or hear that someone has COVID, they try to stay away from them, right? Because they consider them contagious. So you heard that the nurse said, she found that she was a leper. And when people have leprosy, it's like that is the worst disease you could maybe ever get, because people look at you strangely, they don't want to sit next to you, they don't even want to speak with you, right? So stigma because of COVID, persons have contracting the virus. That is one reason for stigmatization and discrimination in this time. So Abby, working in the health sector, have you ever experienced any stigma? As you being a nurse, have you ever experienced like somebody saying, "Nah, you working with these, you're working in the hospital, they are wrong"? Have you ever experienced anything like that?
Personally, no. I mean, people have their illnesses, but it wasn't contagious where, you're going to shun them and keep away. I've never
Yeah.
really experienced that, yeah.
Okay. Well, it's good to know that you did not experience it personally, right? But I have definitely witnessed, especially, so she would have been in the workplace and it would have been her fellow workmates, her colleagues who would have been treating her the way that they treated her. Even some relatives or other family members, they treat the person who contracts COVID like as if they are dirty. Now these days, if somebody as much as look as they're gonna sneeze, people don't even want to be close to them, right? Just this week, right now, Maxi is at 75% capacity, and a gentleman was very much angry because any Maxi, the back seat can hold 3 persons, right? And the guy who came in went in the back seat and sat between 2 other men, and one man say, "I am comfortable, like this thing, people stick up. So now persons are even discriminating against others just for the mere fact of you are a human being sitting next to me or standing close to me, basically, because they are afraid that they contract COVID-19, right? And COVID-19 because of fear. So one of the first things we have spoken about is that fear and anxiety of contracting the virus. And that would come about because of course, misinformation and all that goes on social media. And that adds to the stigma. Now, when it is in the earlies, in the beginning, when persons were contracting COVID and they hear the numbers, what some persons were asking, where this person live, which area are they from? Sometimes they even want to go as far as the person name. And they will say people need to know who it is, right? But really and truly, that is not anybody's business. Mike, I don't know if you're wondering who is the person who had COVID. You want to know who it is. Mike?
Yeah, you must want to know who it is.
Why you must want to know?
I mean,
Yeah, why?
no, really and truly,
Why?
To be honest, just joking there. No, that's their personal, whatever they're going on with them, whether they take the vaccine or not, whether they have COVID or not, that's not the other person's business. As long as you secure yourself and see about yourself, But discrimination is a very big word, eh? Some of us take it very lightly for the smallest thing. That's why I said in Trinidad, we discriminate a lot, but we don't know how serious it is. If you ask Abby, she will tell you. You can't just discriminate people just like that. But in Trinidad, for the slightest thing, even through the COVID now, we discriminating like if it's normal.
Yes, and it would have had some families. So let's say someone know of a family in a community and they know one member of that family got COVID. They don't even want to have anything to do with the other family members, because they are thinking that they are going to take it and bring it to them. Even if it is they leave from one person leave their home to go out to work. It's or the person returns from they're quarantined, they are now negative, they are not showing any signs or symptoms, no cough, no nothing. And it's like, what a person doing here? And them had COVID, right? But the thing about the only reason why someone should know, you see the contact tracing, that is what is most important. Contacting those who were in contact then with someone who is COVID-19 positive, who tested positive for the virus, right? And what it is we look at the negative things. We don't look at, okay, this person, overcame the virus. They are now negative. They are seeing that person as a threat to their life. So they start to discriminate against them, just as persons may, discriminate and they have a stigma against persons with HIV or AIDS, right? And it is COVID-19 now is the biggest thing. People, like, they are afraid. So as I said, fear and misinformation is the driving force of stigma and discrimination against persons who would have contracted the virus. Yeah? Yeah. So they see true talk. So Trinity saying they're moving like how folks were when the AIDS epidemic hit in the 80s. Real discrimination. Exactly.
Yep.
Exactly. Right? So agreement there. So people, we have to understand that once it is we do what we need to do, there's no need to fear, there's no need to worry. Yes, it might be a little anxious if it is to get the virus. And there's no need to discriminate because it has no face. Anyone can get it. Another thing is persons, having stigma and discrimination against migrants. So we had when the Venezuelans were coming in, they were like, them Venezuelans them bringing it. You see they coming in the numbers and they leaving Venezuela and coming over here and bringing it. Mike, I don't know if you remember when that was happening, but that is what people were saying. They were blaming the Venezuelans for the number of COVID-19 cases.
Yep.
Right? And that is stigma and discrimination. Right? So we put the blame instead of we people saying, I really went and I was in a private jet that maybe had no Venezuelans. They are blaming the Venezuelans for bringing it in. Hi, Maria. Welcome to the effects of COVID-19 on the family.
Hi, Maria. Welcome.
We want to say good evening, good night to everyone who is joining us. So we have Abby from the UK, so it's definitely night by her, maybe heading into morning shortly. And of course, Mike, the man. Yes? So people, we are talking about stigma and discrimination. So Trinity is saying, I just read on MacBook that our PM is back in quarantine for being a primary contact around someone who tested positive for COVID. And remember, he got COVID as well, right? Our Prime Minister, he contracted the virus. And I must say, I am thankful and fortunate that I didn't contract it, but I know of persons who did. I would have seen them, but it doesn't mean that I'm going to change the interactions that I have with them, right? Mike, I don't know if you know anyone personally who got COVID.
No, but I know of many people who take the vaccine too. But you have a good point there. Why would you want to stay away from an individual that you have been in contact with all the time, and because they contract COVID, you want to stay away all of a sudden, like, stigmatization.
Yes.
All right. Just like what Nikki said, the AIDS, when I was here, exactly. Everybody were like, I ain't want to go by them. I don't want to kiss them. I don't want to this.
I want to hug them. Why?
Exactly.
Misinformation.
Exactly.
Right? So misinformation is a real driving force. Good afternoon, Mrs. Lewis. Misinformation is a serious, serious driving force. Oh, yes, and he is fully vaccinated. Yeah, so I know of persons who would have contracted the virus. I know of persons who would have overcome, they have tested positive after. But of course, you're going to have persons who are stigmatized and discriminate. And, people think that persons who get the virus, they will maybe in a private jet. That is one. Some persons they think, okay, the person they maybe went by a venue or the also like the lady, she was saying that, Hatcher said because you committed a sin. I mean that's like really extreme. Because of a sin, you get COVID-19.
But
Like
remember last
how
week, sorry, Chic,
how
but
my
remember last week. You remember
yeah.
last week that I told you about the pastor and the guy?
Yeah.
So
You
what is
can
that?
share the story. I don't
Yeah,
know what
when
that is.
yeah, because you telling the man he come to do Bible studies and you're telling him if he don't take the vaccine, he go to hell.
Right?
So this one is a sin. So you're sinning.
All right. So Trinity saying she was also under quarantine because of secondary contact.
Right.
Yeah.
Yeah.
That's another thing I was fortunate for. I did not have to go into
Quarantine.
quarantine and any
Okay.
self isolation. I was able
Okay.
to,
Move about.
move about. Yeah. So that's a good thing, I must say. So people, let us, be thankful that we either didn't contract the virus or we weren't any primary or secondary contact. In addition to that, let us be thankful that persons who did contract the virus, that they are now well, they are now negative, and they are able to live and move forward and have a healthy life. Yeah. And there's now the other part of the vaccine, of course. There's definitely stigma and discrimination there as well. Right? So we'll go to a short break and come back. So before we go to the break, we'll read Nicola's comment. Listen, I went for my vax and I prayed to God before, during, and after, and I am okay so far. Let God be your guide. Right? So that's Nicola saying that she did her part that, she felt bad. Yes, we're going to go to a short break, and when we come back, we are going to continue the discussion.
Yes, one. Nice one. So we are locked on to the effects of COVID-19 with our social worker, young social worker. The topic today is, what is the topic?
Stigmatization.
Right. So we'll be right back. Just a little smooth, sentimental music just to keep the mind at ease. All right. So we'll be right back.
Boutique TV is about merging
Boutique TV is where we bring the vibes.
Yes,
So we're back.
yes.
We're back. Take it over, Shamika.
Yes, so we have, for those of you who are now joining us, the topic today is stigmatization. So welcome to the effects of COVID-19 on the family, the blueprint. And we were just speaking about persons who would have contracted the virus, that they are discriminated against because they contracted the virus, people thinking that they are still contagious, maybe even as if someone has chickenpox as well. And I think that really has to do with misinformation and fear of what can happen to you if it is you get the COVID-19 virus, right? And moving forward, so families, migrants, people, they are saying, this person is responsible for bringing the virus into the country, those type of things. And that all has to do with misinformation, right? So that's why we have to be very, very careful of what it is we are saying. And, the main factor of discriminating against someone because they did contract the virus. Because some persons go as far as they don't even want to have a discussion. They cut all ties with persons who they would have known for quite some time, right? And now we also going to have a lot of stigma and discrimination, as we are having, vaccine rollouts and mandates. it is becoming even more serious. So now it's not just the virus that we have to deal with. We have to deal with the vaccination aspect of the COVID-19 virus. So, Mike, I know it is harass you all the time when you go and get a vaccine, right? And Abby too. I just be like, what? You're not going to get vaccinated or what? But it doesn't mean that I'm not going to be speaking to you all, although we're not, in physical contact, right? But some persons are going as far as not having any type of physical contact with
that's
persons
bad.
who are not vaccinated or even persons who are vaccinated, right? Because at the start, you would have heard that persons who are not vaccinated, they would say, those who vaccinated feel they reach out, they're up there and they feel like they are the best, right? They feel they have, high class and status, right? And then we have the vaccinated saying, those persons moving like they have no sense, So, I mean, it's not everybody who is vaccinated or unvaccinated saying this, but because we know that they said it's not mandatory and persons have to make their choice. But we are definitely seeing persons discriminating against others for not taking the vaccine or for taking the vaccine. So, Abby, now I could ask you this now. Have you ever been discriminated against or stigmatized because you have not taken the vaccine?
Definitely. Yes, when it first came out and started to roll out, I think there is me and another person in the company in my section. We're the only two people out of everyone hasn't been vaccinated, and I mean, due
Oh.
to everyone still have to wear PPE,
Mm-hmm.
it
Hi,
wasn't that
Sharice.
bad, but you could still feel a little tension against you. Like
Mm-hmm.
like the woman said, like you had for just thinking about it. They were snotting their nose down at us, and knowing me, it roll off my back. I didn't really pay much attention, but thinking about it, it really did
Yeah.
had a little bit of stigma behind it. Yeah.
Yeah. Definitely. Right? Because I mean you may have been getting along well with these persons before the vaccine came out.
Mm-hmm.
That sound like not really now. You weren't that close anyway, so it doesn't matter. Right? But you all
I
may have
mean,
had,
yes.
a better, working
Yeah.
relationship then, but it maybe added some more tension, you know. Trevor just put a whole essay there. Thank you very much, Trevor. And right. So next part of his comment, the world is a depopulation plan. Is in full effect. They are accomplishing their goals. Once you are true, white, and spiritual person, nothing can harm you. Discrimination is part of their plan at different levels for hundreds of years. So stay strong and be focused.
Nice one.
Right?
Yeah.
So that's the views of Trevor G. Yes, so he believes it's a depopulation plan. Right? There are so many ways that people right now making personal choices not to have children, without this whole COVID, without the vaccine. People are already saying, I'm good, like me. Right? So
So wait. So we're trying to tell us we're not going to see
No
a
chicken.
young lion.
let me
What?
tell you something, right?
Nice.
Let me tell you something here.
Nice.
This is the effects of COVID-19 on the family, the blueprint, and we are speaking about stigmatization.
Right.
All right, people. So, I mean, Trevor G, he's one of the persons who definitely said he's not taking the vaccine because he does not believe in the vaccine. Yeah? Right. So we have a comment from Mrs. Lewis. She said, I had a problem with one of my custom officers where he asked if I was vaccinated and I told him not right now. Then he said, well, I am vaccinated. I told him, well, then you need to go to a different department. right? So what is happening is that there are persons who are vaccinated that are looking down at those who are unvaccinated, right? And that is like, I mean, for some persons, you don't know what their situation is, so you don't have a clue as to why it is they are not vaccinated, right? And during this week, some of the students, some of my clients, they were saying that they did not get vaccinated or they are afraid to take the vaccine for the mere fact that they are afraid of needles. So, some persons have phobias, and some persons, they may literally have to hold them down or give them anesthesia, put them to sleep to administer an injection or whatever of the sort, just to do what they need to do. There are persons who are, really, really afraid of needles. Now,
Like me.
I I'm not afraid of needles, right?
Me.
So it's like, how are you afraid of needles, right? Because the needle is small. It's not a big needle, right? But there are persons who are honestly afraid of needles. Now, some persons also had bad experiences, when they were growing up within the health sector. So they have no trust. That's another thing. There is no trust in the system, right? And because there's no trust, some persons choose not to take the vaccine. They're not sure what's in it, even though they may have the information there. They still don't trust what is being presented to them, so they will not take the vaccine. Yes. So we have Verena with us as well this afternoon. All right, Verena, have you experienced any?
Verena or Sharice? Which one?
Well,
Verena. Sharice is my middle name.
I will
That's
always
kind
be
of fine.
calling her Verena.
Yeah.
Okay?
Yeah.
She has Sharice up right now, but she knows who she is.
I hope so.
Yes.
We hope so.
Oh my gosh. So Verena, before, have you gotten your second dose as yet by chance?
No, not yet.
Okay.
Not as
Right.
yet.
How long again you have? Because I know it's the AstraZeneca that you took.
It's in next month. I'm getting it in October, the
Right.
10th of October.
Right. So that was another thing, right? Imagine persons are also discriminating against the vaccine itself, like which brand they should take, right? So that's another thing that is happening. Which brand? Should it be the Pfizer? Should it be the Sinopharm? Should it be Johnson and Johnson, AstraZeneca? So even that too, there's some form of discrimination. So some persons they discriminate, but China, well, they get full stigma. They get blamed for bringing COVID-19, and then they say, they don't even, some persons don't even want the vaccine because they're saying it comes from China and they don't know what's in it.
They
so
can't
that's
trust
another,
them.
yes, stigma and discrimination there for sure for China, right? So against countries as well, right? So I mean, it is so much that some persons really cannot handle. So imagine contracting the virus and then not taking the vaccine, because of course it's a personal choice. Some persons will say, if I got the COVID-19, so now I already have an immunity to it. Yes, some persons say that, right? But they are still encouraging persons who would have contracted the virus after the 3-month period that they can be vaccinated, like our Prime Minister. You don't know where it is you're going to get it. When you travel amongst people, once it is you come in contact, and you don't want that. I mean, it really can make someone feel isolated. It can make people feel depressed. We spoke about depression as well. So imagine discriminating against someone and they okay, so we have a comment. So Nikki is saying, I'm wondering how much people again need to die and economy is crushed for these new world leaders need to see until they stop so we could go forward, right? So I mean, we are responsible for the choices that we make. So no matter what it is we see on social media, no matter what we hear word of mouth from someone on the street, we still need to make the responsible decisions. Yeah, we really, really need to. And there are some persons who we know cannot be vaccinated. So I was saying, you don't know what is someone's situation. as to why they cannot be vaccinated. Yeah? So we're going to go to a short break and come back, and we will continue in terms of, so as Nicola mentioned, death. That's another thing that I'm going to get into as well. How misinformation is really causing stigma and discrimination. Somebody is having Abby laughing in the corner there. Yes. So we're gonna get into that when we come back. Good afternoon, Rihanna.
Nice one. So good evening, Rihanna. Good evening to everybody who locked on. I see now a good bit of people locked on, even on the live I've shared. So you're listening to the effects of COVID-19 on the family, the blueprint with Shamika James, our social worker here. And today's topic is what?
Stigmatization.
Right. So we're going to be right back. Stay locked. Don't touch that dial.
TV is about merging online lives with basic unconventional raw nutrition services.
Yes, people, it's Sweaty Sunday, so let's get this workout in. You know, it's time to smile, sweat, and shine. Let's go.
Giving it that TV effect while streaming live.
Yes. So we're back. So over to you, Shamika.
Yes. So when we talk about the vaccine, the COVID-19 virus itself, right, there have been cases of misinformation, and because persons want something to hold on to or give them reason to either not to do something or even to do something, I mean, it is really discouraging. So, for example, persons being vaccinated and then dying, but we don't know why, right? Because it has misinformation. So what happens is persons discriminate. I mean, it is very, very serious, because when they started giving the vaccines to children between the ages of 12 and 18 here in Trinidad and Tobago, I mean, as adults, it was really sad, disheartening, disturbing to see the comments persons will put, and these are children. Well, when the children die, drop down and dead, right? These are the things that they are saying. When it is, but that is you, when you lost your child because you let them take the vaccine, that is definitely stigma and discrimination. Definitely. And it's like you calling death upon people's offspring. You don't want nobody to say, so what, because you ain't take the vaccine, you ain't let a child take the vaccine, so what will happen to you? You know? So there's this back and forth, vax against the unvaxxed, as in short, the vaccinated against the unvaccinated. So then it creates a divide. So when discrimination, stigma steps in, it causes further division, amongst people, amongst citizens. So we as need to decide, are we going to allow this to further separate? We already not so united, right? It's a fact. We are not so united. So what's going to happen now? What is really going to happen now? Now we have a little breaking news, a breaking news for you all to see. Yesterday it was posted because, countries are rolling out the vaccine mandate, and it is becoming more prevalent. People are, governments, leaders, they're really coming out there with things, even though they are saying, okay, it's not mandatory, but it's not mandatory, you don't take the vaccine. This is what is going to be required of you. Some persons don't have the money to pay for a PCR test every 2 weeks, or even every month.
Every 2 weeks.
Yeah, every 2 weeks. So even if it is a decide, some might put in the plan where they could do it every month, but it's really every 2 weeks. Because they say within that 2 week period, they could definitely see if the virus is in your system. Yeah. So that's when persons hear someone die, even when persons died after contracting the COVID-19 virus. Well, now, sir, people don't even want to be close to anyone who has contracted COVID. Verena, do you know of anyone personally that would have had the COVID-19 virus?
No.
No.
Not anybody personally.
No,
But
not anyone personally.
no. But I heard of like my husband's friend or things like that. You would hear, had COVID and they get over it and whatnot. Yeah.
Right. So I didn't have that experience where this person had COVID. Well, maybe I want to be around them. I really want to be around them. Why I want to lime? No, it's people who are custom lime and the real limers. It's have who taking the vaccine and who not taking the vaccine. No, it has some people that saying, if it is you are unvaccinated, I don't want you coming in my house, Some people, it is becoming very, very serious. They are saying, if it is you are unvaccinated, do not come to my home. Because they maybe have children, they maybe have elderly, they may have persons who have underlying illnesses that if it is a Gedico, they are at high risk. They are much more vulnerable. And I mean, I could understand persons saying this. So we have Trevor G. The world leaders are blind and misled by influences of unseen forces from other realms. As a wise, sensible community of people who live in natural, immune lifestyles, we are prepared for all their city vaccination games and discrimination. We are uniting in love and resources and solutions to get through this pandemic. And those are the words of Trevor G. Yes, those are the words of Trevor G.
But for me, I'm not going to discriminate, even if you had COVID, right? If you had COVID and you come around, I wouldn't discriminate the person, similar like, those other lifestyle diseases and so on. You shouldn't really, it's not good to discriminate people in the first place. And if it was you wouldn't feel nice somebody telling you that,
If it's on the other, if it's the shoe fit on the other foot.
And anybody could contract COVID.
Anybody. So whether you're praying and not praying, whether whatever the texture of the hair, the color of his skin, it doesn't matter. If it's tall, if it's short, it don't matter. Anybody.
If you stay home too.
COVID.
Some people
you can stay home. Right? They ain't going away and they have somebody going making the groceries and they still get COVID. Anyone
there was a lady who wasn't going anywhere. She just went to the bank to do a transaction and boom, she get COVID.
Yeah, but she did
that one day she went. I know, but what I mean that she had business to do.
She wasn't really going.
She wasn't, out and about.
Some person really did try to limit their movements. Yeah, they really tried. So, Trinity saying I keep hearing about threats of, making the vaccine mandatory. So we have breaking news. We have a next video to show you all about this whole thing about vaccine mandates. Yeah.
Days after an emergency meeting between CARICOM heads of government and ministers of health, Gaston Brown, Prime Minister of Antigua and Barbuda and chair of the regional body, announced sweeping vaccination mandates as the country's newest effort in the fight against COVID-19. Calling COVID-19 a, quote, existential threat, the government of Antigua and Barbuda has announced that starting next Monday, September 20th, all government employees who have yet to be vaccinated must remain at home until proof of vaccination can be supplied. And from the beginning of October, unvaccinated employees idled at home will not be paid wages while they remain non-compliant. The vaccine mandate affects all public sector employees, including workers in statutory corporations and companies in which the government of Antigua and Barbuda is the majority shareholder. Teachers from preschool level up will need to be vaccinated before returning to face-to-face classes. Eligible students and workers at care facilities for the elderly are also subject to the mandate. Workers at ports of entry, including vendors, merchants, service providers, and staff, are also required to be vaccinated beginning October 1st. Incoming travelers to Antigua and Barbuda, including returning nationals, must also present proof that they have received at least the first dose of an approved COVID-19 vaccine to be cleared for entry into the country. Transportation sector workers are also subject to the vaccine mandate. That's bus drivers and conductors, as well as taxi operators. The policy does make provisions for exemptions for people who submit approved medical certificates or those for whom religious exemptions are approved. People exempted from the mandatory vaccination policy will be required to test twice monthly and submit negative results to health authorities. In a press briefing on Thursday morning, Information Minister Melford Nicholas provided this rationale for the move.
And the numbers are just not ticking in the right direction. It's unsustainable. We would as well have had the benefit of a legal opinion from a former president of the CCJ, Sir Dennis Byron, and a member of the legal council at the University of West Indies in Trinidad, that would have indicated that the government has constitutional cover to be able to employ certain vaccine mandates. We would as well have had discussions with the education fraternity over the last 2 weeks and would have delayed the face-to-face reopening of schools simply because we have now seen a tendency where children are becoming infected with this variant of COVID. And accordingly, we would have had to take some stringent measures upon the reopening of school.
Minister Nicholas explained that the government's intention is to achieve sufficient vaccination coverage by the end of the year so they can discontinue many of the public health regulations by early 2022. In addition to the policy on vaccinations, the Cabinet of Ministers also unveiled several short-term measures meant to tamp down on the current wave of COVID-19 infections. Gatherings are restricted to members of the same household. People will only be allowed to utilize the country's famed beaches between 5 a.m. and noon every day. Activities on pleasure craft are now also prohibited until the 29th of September and will need to be authorized by the appropriate authorities after that. Interestingly, employees of the Sir Leicester Bird Medical Center and community clinics across the island are exempt from the vaccination policy for now due to what the government referred to as, quote, the overwhelming epidemiological situation at this time. Since the 1st of August, Antigua and Barbuda has recorded over 1,000 cases of COVID-19, more than half the country's total since the beginning of the pandemic last March. Cara Festa is the latest casualty of the pandemic. Lionel Hurst, the Antiguan Prime Minister's Chief of Staff, announced the cancellation of the festival, which was pushed back from August this year to August 2022. COVID-19's, quote, prolonged devastating impact on the regional economy was cited as the reason for the cancellation.
Interesting.
It's serious. And children is, yes, he keeps talking about October every day, all day. You all don't forget October 1st coming up. Don't forget October. Yes? So you'll see how serious it is. Nikki is saying, I believe it's only a matter of time. They're going to make it mandatory. Now, I know Trinidad and Tobago citizens will be glad if they get the beaches open 5 a.m. to 12 noon.
You know?
They will be glad for that.
Exactly.
It don't matter how quick the dip is. You go take it and you roll out.
We get first time we waking up before 5 in the morning.
Well, that is not me. I always waking up before 5. But they will be glad for that. Right? So we see that they're saying all persons in the public sector. So the people who even drive in the maxi, right? Conductors, people who the vendors, So we're not just talking about nurses and doctors and police officers, The people who they say the small man, they're talking about they too being vaccinated to even sell to the people, right? So Trini is saying a lot of these countries in the Caribbean rely heavily on tourism, and their economies rely on it not only for a source of income but also employment for a lot of their citizens, and that is true, right? So that was Antigua and Barbuda, right? Persons, there are some Caribbean islands, people, they forget about them, but right now, they are making it mandatory. And even the persons who, let us say, due to religious reasons, medical conditions, they are required. So it's not like they're exempted and that is they just go about life, but they will be required to get a negative PCR test done. So you see, they give them the people who are vaccinated right now, they have a 2-week period. So from Monday coming here this Monday coming, they have, 2 weeks basically to get vaccinated. And if it is they are not vaccinated, they stay home with no pay. That's what they're saying there. You all heard that, right?
Yeah.
They will be home with no pay. That's something really, 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 it is serious. No pay. It is. So we are talking about, it is getting very, very, very serious. So I think with these mandates, discrimination, stigmatization can skyrocket. It's already bad enough. So imagine when the mandates in full effect, what is going to happen? So even children, as well, if it is there in certain families and their parents, it have some, yes, carrot and the stick. As you were talking about this morning, children talk about the carrot and you talk about the stick. Everybody, nice, you could nibble on a carrot, things nice. But then we will pull out that stick and the stick could be a hard stick. When the hard stick really and truly, right? So there are children who would like to be vaccinated, but their parents do not believe in, taking the vaccine. It leaves it open now for the children to be discriminated against, to be stigmatized for that, right? Then there are some, of course, the parents, they will take the vaccine, but they don't want their children to take. It have so many sides. Now it's not just a coin. It's a box that we're dealing with. So it have this side, that, the bottom, the edges, and the corners as to why persons may or may not take the vaccine, right? And when they make it mandatory, we can't really talk about choice and all of this. Mr. Lewis. Mr. Lewis.
Well, he say carrot and a stick. I say saltfish and rice for me. I don't understand that.
Yes.
If only want me to do that, give me some saltfish and fish, then I go that way. Yeah. But but you know what? What I was listening to what they were saying in Antigua and Bermuda, and especially the part where they talk about if you don't take vaccine and you stay home, when you had to stay home, you ain't getting paid. You can't do that in Trinidad,
Why not?
I don't think so. They go harass.
Mike,
I telling you.
we don't know. We
Staying
cannot
home.
say.
Stay
Yes,
home
staying home.
and not getting
They will
paid.
say, yes, they will say no. When if it is they make it mandatory, Mike, and it is passed, then it wouldn't be a matter of riot or anything, They will say it's your choice, you choose not to get vaccinated. That was your choice and these are the consequences. That's the case.
Right now they're studying the law and they're studying how it is they could bring it into bringing it mandatory. Antigua
Yes.
and Barbuda's law probably stated a bit different to ours. So that's why they could bring that out. I don't know. I'm
Yes.
not a lawyer, so I don't know what
Yes.
direction they're going to take in our country, but more than likely
Right.
they will
So,
find a way.
Trevor G just, he's pouring out his heart here on the live, right? So children is saying, but if it have riot, you still get no money. You have no money to get, so
Exactly.
riot, no riot. The riot ain't going to change anything.
Change the fact, exactly.
Do you hear what
Yeah,
Trevor
it's
said?
not. He he say life goes on. You'll read the next comment after. So he's basically saying that, the world leaders, governments are forcing persons to take he's saying the vaccine is fake, right? And he is like they had less, they willing to see persons lose their jobs, children home from school, persons with no access. Right now, everybody they say every choice, every action, anything you say do, there's a consequence,
Consequence, yeah.
right? And we have to be able to live with the choices that we make. We can't blame somebody else. We still had a choice at the end of the day, right? We really still have a choice at the end. Some persons may say no, but anyhow you take it, you still have to decide what it is you're going to do.
Mm-hmm.
If that right now it will seem as if here, but we really don't have a choice. But yes, we still do have a choice. Yes, so some things to help with not to prevent stigma and discrimination is that one, when it comes to the COVID-19 virus itself, when it comes to vaccinating, yes, we want to be able to get the information from the right sources and not just what is placed on social media. So, for example, Nicki Minaj, friend, cousin, friend, whoever, with swollen balls, swollen testicles,
I don't know. That's a
right?
real weird thing, yes?
Yeah, so we want to get the right information from the right sources. That's one. And so there wouldn't be any misinformation. Now, there are lots of things out there. Everybody will say everything is basically information. Once it's out there, whether it's good information, bad information, right information, or wrong information, it is still information. So we have to really be careful of the sources, in which we get our information from. That's one. Two, instead of, so I was talking about the culture of, certain parts, right? Where it says, okay, so we're supposed to be, when someone contracts the COVID-19 virus, or let's say someone, after taking their first dose, they pass on for whatever reason, misinformation, get the correct information because it may not have any link to the vaccine itself. You do not know. You just say, hey, that man, he tell me he went for the vaccine and, next day he dead. He dropped down dead just so. You don't know why it is that individual passed away. You understand? So don't just go about saying things that you don't know about, right? And I would have heard someone saying that, well, I didn't hear it was passed on that, someone died because they take the COVID-19 vaccine, right? You do not know what is the cause of someone's death. You did not do the autopsy, people. You are not there. You are not the doctor, right? So be thankful for those, let us say, those who contracted the virus, they are now COVID-19 negative. Be thankful. Be thankful that they're able to do the contact tracing so that other persons will be, they will be aware and they will get the medical care that they may need if it is they are seriously ill. Because what happens is because persons know of the stigma and discrimination that is meted out to persons who contract the virus, if it is they see they are sick, they're going to isolate themselves and try to move like everything normal, and then they may get so ill, it will be too late. It can be too
Exactly.
late. some person, if it is a sick, they're not going and say they're sick, runny nose, they will say something else so that they don't need to go and take the test. Some person even afraid of getting tested for COVID. So if they say here that they were a primary contact or a secondary contact, persons delay happen is only when they reach in the late stages. There is either they're in ICU. No, it gets so bad. You don't want that to be a situation. Yeah. Next thing is you do not need to know who the person is. That is not your business. You don't need to know who got the vaccine. I mean, who got the virus, where it is living, and how to find them, and who all their family members are, so that you can stay away from them. Right? That is none of your business. Right? What you want to do is send words of encouragement. You want to lift person's spirits and, wish them, a speedy recovery if it is they do contract the virus. And of course, we don't want to label anyone coming into the country. We don't want to be, persons who are at a social class, saying that they are the ones, because we know where these deaths and the private deaths come from. Right? So Maria is saying most persons sniffing outdoor claim it's allergy season, yes. So some persons, they may have the virus, but they'll just say, nah, I have sinuses, or I have asthma, or whatever it is, and the blame right now, when the Sahara dust out, people might say it's the Sahara dust, right? So we have to be careful about it because it could have negative repercussions when it is there's stigma and discrimination when persons contract the virus.
Question. Before
Yes.
this whole COVID thing, didn't people used to have allergies?
Yes, that we are not saying no to that. But there are some okay, so like if someone has an allergy, of course they will be sniffing. But some persons, they have a sniff, but they also have a high fever. And they will try to move it. How some people really try their best to hide. They come like somebody hiding their sorrow, right? They put on a smile. They really try to put on this act. They might be very weak and they're trying to go just so nobody will know that they are really unwell. Whew. So, Nicola, I think rioting is a step backward rather than moving forward. Our economy isn't the best at the moment. So, Trinis, while it's your choice, regardless of what vax or not vax, we all experiencing the same pressure. So how are we going to move forward and for all of us to benefit? We Trinis like to talk and don't I ain't finished with that one. Right? And don't want to do something because of their reasons. So give suggestions on how we can move forward in our country. They ask you to vax, you say no, no problem. They ask you to mask and seem like the school's very, very low. Nikki, put these things in shorter, yes, thing, yeah, but sneezing now come like the plague, which is true. And as I said, persons just walking by, person looking like if they're sick, they could just look, I don't know, they could just, people might look at somebody and say, that person look like they're sick, and they don't even want to we know they have the social distancing, yes. But as I say, even this week, a man, he rants and rave in the maxi. So I don't know what is going to happen when they say, your drivers, you all can go back to 100% capacity. And COVID is still around, right? I don't know what is going to happen. I really, really don't know what is going to happen.
But they say that COVID is with us forever,
Yeah, it is going to be, yes, it's going to be, we have to live with it, we have to accept it. So anybody have any?
Still get it and pass on.
Yes. I mean, anyone can get the virus, anyone can, So Verena, do you have any words of encouragement for persons who would have gotten the COVID-19 virus, persons who recovered, with the people who are discriminating and stigmatizing against others?
What I have to say is continue taking care of yourselves. Right? That is one of the main ways we could come out of this thing alive or remain healthy and so on. So take care of yourself. And only
Yeah.
give people information unless it's necessary. You don't have to tell your friend or your neighbor or whoever that you got vaccinated. If you want to tell them, you can tell them. But if
Yeah.
it's necessary, then of course, if you
Yeah.
contracted COVID-19 and you were in a, like you had spoken to your neighbor, you was around them for some time, you may want to inform them, right? But other than that, you got your COVID and you overcame it. You don't necessarily have to tell anybody, hey, I got COVID-19 and so on, you know. So keep information to who needs to know, needs to know.
Yes.
And
I
that's
need
it.
to know basis.
Yeah, I need to know
Yes.
basis.
Yes, definitely. So Nikki is saying that there are drivers who are um carrying 100%, and there are passengers who are encouraging it. Now, I didn't have that experience, yes, but there are some persons who will still try to, whether know the police really not
Well,
around, to
I
charge
never
them.
had that experience, but here's what my family is big. I have 5 members in my
Yeah, so
family.
Ole will take
So
up a car, and that will,
we
yeah,
will
that
take
will
up an
mean,
entire
yes, yes, you will take up an entire car, right? But you're talking
so,
about on a regular. Some
but
person
they
might say,
I
nah,
didn't
they're
see that
written right
happening.
there. I mean, they will say they're written
Yeah.
right there. I mean, if it is the other part, it's kind of really tricky in this time to say what's okay from what's not okay. Now, you as the
Mm-hmm.
passenger, every driver want to take the charge, well, that is up to him. Abby, any words of
Exactly.
encouragement?
I would say the same thing Verena said, try and keep healthy, stop drinking, smoking, and other junk stuff. You keep
Yeah.
yourself healthy, join the burn team, and keep fit so you can limit yourself from getting any kind of virus, not only COVID,
Yeah.
but other flu-like symptoms and, you know.
Yes, definitely. Yes, so as Abby said, you can join the burn team. So don't forget, tomorrow we have Sweaty Sunday at 7 a.m. Bring your broomsticks. Get a nice workout. Maria, if you are
Yes.
interested in doing a nice workout with us, feel free to message us and we will send you
Yes.
the link.
Let me see
Yes, Maria?
Maria. Yeah.
Yes.
Come
So
on,
yes, you
Maria.
I
can
have
empty a
testament
whole
to the
link if you need.
exercise, you know.
Huh?
I
You have testament?
Yes, I used to walk out to go and meet my sister and I will be blowing. But now I walk
Mm-hmm.
out and I'm not blowing. I walk out and I walk back in. That's how I end
Okay.
up reaching
Right,
late on
right,
the
right.
show tonight. So, because I went and I tried to come
So,
back in time, but
Farina, that testimonial also lines up with the hanging out the window.
it lined up with the hanging clothes on the line because
That's
Shamika just have my
poverty.
hand up so whole time. I could hang up clothes without paying now.
Yes, so we have one last video. So we want to thank everyone for locking on tonight
Nice one.
and sharing your views, sharing your opinions, sharing your experiences. And we want to encourage you, try not to stigmatize or discriminate against anyone because you really don't know their situation and you don't know if you will one day be in that position. Yes, so see you tomorrow, 7 a.m. Sweaty Sunday. Taking this last video, just wrap up a conclusion to the thing and a little encouragement at the end.
Nice one.
Nice.
So, you've been listening to the effects of COVID-19 on the family, the blueprint, and, very interesting topic. This is going to come to you with Shamika James, our social worker here. Guys, have a good one. Let's take it away. Run the video!
Namaste, I'm Prasiti Shrestha, the second person to test positive for COVID-19 in Nepal. Some media were quick to accuse me for the spread of the disease. Social media was flooded with comments and threats. This was as hurtful to me as the disease itself. Fortunately, I was able to recover in a month thanks to the healthcare workers involved in my treatment and the support of my family. We are all at equal risk of COVID-19. Hatred and discrimination not only cause mental suffering in patients, but also give others a false sense of security. Let's give patients the moral and psychological support that we would give to our own family members if they were infected. Let's spread messages of compassion and empathy and give those battling the virus love and encouragement. Let's help lift their spirits. Stay informed, stay safe.
Some things were meant to be.
Your man say he don't like me. I don't like that you just call. You think you something. He make your man follow me on IG. Motherfucker on follow them. But I still think about the 90. I think about what it might be like if we link up. I know you have someone. I know, but I still wanna keep it and keep it a secret. I know you have somebody, but I still wanna link up and keep it in touch. Let me take this. There is no one could ever call you a fraud. Because you're hotter than them. You are the best overall.